Hi, everyone. Thanks for joining us tonight. I'm John Catch. I'm with the Academy of Health Excellence and Empowering Benefits. Tonight we're going to introduce you to health sharing through Health Excellence Select. It's a bold, fresh alternative to traditional health insurance that is really exciting. It can and truly change the paradigm that exists in this country today. Now, health sharing is not a new concept, but it's a concept whose time has definitely come. And here's why. I want you to take a long, close look at the picture that's up on the screen. There's more truth there than fiction. Unfortunately, it's not just insurance companies that are getting between you and your doctor. It's the federal government, too. And through government intrusion, we have less and less control of something that's vitally important and deeply personal to each of us. It's our own health care. Now, as far as the Affordable Care Act is concerned, as well-intentioned as it might have been, the single biggest failure is that there's nothing in the Affordable Care Act that does anything to control the cost of medical treatment, of true health, not the cost of insurance, but the actual cost of services. And they'll continue to explode without anything to impede that growth. Simple reason why. With a third-party payer, we're effectively spending somebody else's money, so we're not real judicious about it. We worry about what our co-payment is, what our deductible is in the world of health insurance, with little regard to what the true cost of the procedure or the service is. We can help you change that. I want to be clear about a couple of things. There's no perfect solution for everyone. This comes very, very close. This is not health insurance. Health insurance is a contractual obligation, a guarantee, whereby one party agrees to be legally responsible for and accept another person's risk of loss in exchange for a monthly payment called a premium. Health sharing is an agreement. It's a promise whereby like-minded individuals agree to share each other's medical expenses. And in doing so, we become stewards of that money. And we're going to talk a little bit about, what that means in terms of real-world practice as we move forward. Another glaring difference between health sharing and health insurance is, health insurance really become a system of disease management. You go to the doctor when you're sick and you're not feeling good or you get hurt. Health Excellence Select believes that fostering and encouraging true health and wellness is the best way to avoid the high cost of medical care. Obviously, if you don't get sick, you don't have to go to the hospital. If you don't go to the hospital, you don't incur a big bill. So a very large portion of our discussion tonight is going to be Health Excellence Select and how we provide you the tools and the wherewithal to become an excellent self-pay patient, achieve and maintain wellness in the process. So who is health sharing best suited for? Well, frankly, you've got to have the right mindset. You've got to be health focused. And, we don't mean have to be healthy, but you do have to have a desire to be healthy. And, if that means, doing some education, we can help you do that. If you have specific issues you want to address, we can help you do that too. Health sharing is significantly less expensive than traditional health insurance because it's a nonprofit. It's for members by members. We're truly a community that's part of a very, very strong movement in this country to shake the status quo. Another big advantage to Health Excellence Select is there are no provider networks that you have to worry about. You can go to any doctor anywhere in the country. And that is really liberating to be able to have that knowledge that if something bad happens to you, you can seek out the best care and you don't have to worry about it being paid for. Well, we talk about being a self-pay patient, and what that means is, when you go to the doctor's office to have a procedure done, knowing what the cost is, it's called being responsible for the cost, not responsible for the payment, but being cognizant of and recognizing that there are costs associated with everything you do. self-pay patient is anyone who wants to take control of their own health care and get out from underneath bureaucratic medicine. Get rid of the insurance company, rid of the government that dictates the who, what, when, where, and why of our own health care. The decision about your own health and well-being is now between you and your doctor the way it should be. Now, at first blush, that seems a little bit scary. We talked earlier about the escalating cost of health care. I'm the poster child for that. 2 years ago, I had a triple bypass. My bill was $246,000. After negotiating, the insurance company brought that down to $146,000, and my responsibility was a healthy $12,000. Monstrously expensive, $246,000 for an 8-day stay, and the room wasn't even that nice. So my point is that it is monstrously expensive. So taking on that responsibility of being aware and controlling costs can be a little bit scary. But if other health-conscious individuals just like you agreed to share your medical costs, in return you would share theirs, above and beyond the nominal amount that you felt that you could comfortably pay. Sounds revolutionary, but it's really not. It's been done for decades. Now, from the standpoint of a patient, from a patient's perspective, health sharing looks and feels very much like insurance, but it's vastly different. And the best analogy that I can draw for you is a comparison between a bank and a credit union. From the consumer standpoint, they look and feel exactly the same. They do the same thing. They provide banking services, checking accounts, savings accounts, credit cards, personal loans, mortgages, auto loans, and so forth. But how they operate behind the scenes, vastly different. The ownership of the bank is a corporation with a CEO and a board of directors. And his feet are held to the fire to generate profits. Why? Because dividends, because share price is what drives all decisions. Typically, banks have higher rates and fees. They're larger in size, which means they typically have more product offerings, but there's no local control. Decisions are made in a nameless, faceless, bureaucratic boardroom someplace that you have no participation in. Credit unions, again, very different. Ownership by members for members. They're a nonprofit. In their charter, a credit union says that at the end of the year, if they have excess funds in their reserve account, that goes back to the members in the form of lower rates and fees, and it's sometimes cash dividends. Almost universally, credit unions are smaller in size. They're focused on the needs of the membership, and they develop products to do just that. They're all about customer service, and the decisions are local. There's more flexibility. So how does that pertain to our discussion tonight? Well, we can draw a very similar comparison to how health insurance companies work versus a health sharing organization. Again, the look and feel is going to be just like an insurance company for you, but behind the scenes, very different. Health insurance, you got to choose a plan and hope your doctor's in the network. With health sharing, choose the doctor first, and then we worry about making sure that they accept Liberty Health Share. It's lower a monthly contribution. Instead of a premium, we call it a share amount, but in some cases, half of what traditional insurance costs. No government subsidies. The ACA, a penalty is waived, so there's no penalty even though you're not purchasing a quote-unquote qualified health care plan. There is underwriting. And what I mean by that is with health insurance today, it's 100% guaranteed acceptance. With health sharing, there's a health questionnaire. There's no physical, there's no blood test. They do not pull a medical information bureau report. And typically they accept 98% of the applicants. What happens is if you have a pre-existing condition that can be mitigated through lifestyle changes, you'll be accepted under a provisional plan, a health track plan. If you have a significant, serious pre-existing condition, disease management, more than likely health sharing isn't for you. Again, for the price point, it's not for profit. It's for the members' benefit. And ultimately, you are in control. Remember, it's by members for members. So in sketching that out for you, we'd like to give you a little bit of a comparison. It's very difficult to compare prices with true health insurance because health insurance is age banded. Much more expensive for a 60-year-old to buy health insurance than it is for a 30-year-old. Health sharing, one flat fee. For an individual, it's $249, male or female, regardless of your age. Couple, $349, a family, $499. That's the monthly voluntary share amount that you would contribute. Remember, under that scenario, you can go to any doctor. To have that same type of flexibility, you'd have to choose a PPO, a preferred provider organization, with a health insurance company. That same family would pay $1,251 a month. That's based on somebody who's 55 years of age, 3 members or more in the family. That's a mortgage payment. That's awfully expensive. $1,200 times 12 months, that's $14,000 a year that you're paying for the privilege of not getting sick, because you're going to pay that regardless if you ever go to the doctor once. So there's a significant difference in terms of the pricing. Now, the pricing that we talked about is, again, regardless if you ever go to the doctor, you're going to make that monthly payment or contribution regardless if you ever get sick. But what happens when that other shoe drops and something does go wrong, that you do get sick, like me, or you get hit by a bus and you're in the hospital for a month? Well, that's when the problems really come into play, because with traditional health insurance, the out-of-pocket maximum, the combination of deductibles, co-insurance, and co-payments, can reach as high as $12,600. Now think about that guy that's paying $1,251 a month for his PPO plan. He gets hit by a bus, is in the hospital for a month, has a $40,000 bill. He's responsible not only for the $12,600 out of pocket, but the $14,000 that he's paid in terms of monthly premiums. $26,000. That's a big pile of money. Now you compare that to health sharing, that same family, $499 per month is a share amount. That's $6,000 a year, plus a maximum unshared amount, the amount you would pay out of pocket, of $1,500. So we're looking at a spread between $7,500 and $26,000. That's, again, an awful lot of money. So it is extraordinarily cost-effective, and there's a reason why. We'll get into that in just a second. The reason why is what I alluded to earlier. It's achieving and maintaining wellness. You get healthy and stay healthy. You're not going to fall victim to chronic illness, to chronic conditions that consume a tremendous amount of medical services, and those are the ones that are most expensive. We do that through a unique WellFit sharing community, and that's the central hub, the starting point for everything else that happens with your health care. One central location where you can stay abreast of the latest trends in health and wellness, specific areas of your own health and wellness that you want to pay attention to, whether it be diet, exercise, emotional well-being. Everybody's different. We all have our own issues, problems, and picadillos. So there's, again, a vast array of knowledge that's available for you to address issues that you have. Additionally, as we go through, we have the health sharing through Liberty Health Share as the cost mitigator. We help you do a health assessment to see where you are. Pursuing health and wellness is a journey. And when you're going on a trip, you need a map. And to use that map, you got to know where you're starting from. So that's really one of the things that our health and wellness experts are here to help you do. 24/7 telemedicine, discounts, dental, vision, and hearing. Now, I want to point something out to you. with health sharing, prescription drugs are only covered for 45 days before and 45 days after the onset of an illness or the occurrence of an injury. Okay, at that point, they do not share the cost of maintenance medications. So I'm going to give you an example of what we do to help mitigate some of those costs. You see this concierge, this individual right here? That concierge becomes your guide and your navigator through this entire process, whether it has to do with the welfare sharing community, if you need a specific service, or if you're looking for a physician. Regardless of what your concern is, we can help you. So I want to talk a little bit about a real-world example of this prescription situation. This happened. A client was recommended or prescribed Lipitor. Yes, he could take the generic, but it's still an expensive drug. And here's what I want to point out to you. One of the tools I use, this individual called Lipitor. Doctor said the generic was atorvastatin was acceptable, 40 milligram dosage. Again, we're looking for pricing in Boca Raton, Florida. And if you'll notice, the estimated cash price ranges anywhere from $64 at Target to $199 at Kmart. And this is for the generic. That's a 200% spread. That's what I talked about with lack of visibility, lack of transparency in medical pricing. This particular tool that we use, GoodRx, has found that with a discount card, discount coupon that you print right off your computer, that same medication costs $12.80. Now, we also do the same thing with medical services. This is an example, also Boca Raton. Individual is prescribed an MRI for their degenerative hip disorder, and they have to have, some imaging done. So again, another tool, Save on Medical. You'll notice that $1,734 is the typical price in this area. And yet we can see pricing here down to $419, $440, $444. Again, a vast spread. When the doctor tells you in the world of health insurance to go get an MRI, you go to the local hospital. It's close and it's convenient. He might have admitting privileges there, so that's where he sends you, without any regard or any notion as to what the true cost is. So we're putting consumerism, visibility, and transparency back into the medical and healthcare world. So again, people ask, how is it that you can keep the cost as low as you do? $249 a month for an individual. This is how it's done, and it's done with the help of a healthcare advocate and a concierge. Most of all, or most importantly, because this is technically a faith-based health cost-sharing ministry, it is exempted from the Affordable Care Act and any penalties that go along with that. Very simple filing process when you do your taxes. Very easy to do, and again, we have the concierge service to help you do that. Did that all on one breath. I certainly appreciate your time and attention, and I'll leave this up on the screen for a little bit. We hope to hear from you soon, and have a wonderful evening. Thanks so much.